Hello viewers, welcome to the program Safe Life. My name is Ishime Kathy, and today we are going to be talking about root canal treatment with Dr. Ntwatwa. You're most welcome to the show. Please say hello to the viewers.
Hello viewers, it's nice to be back once again with you.
Well, we're talking about root canal treatment. We would like you to take us through what it is.
Root canal treatment is basically treatment of a sick and dying nerve. Some people say root canal treatment is when the doctor kills the nerve.
Yeah.
That's not right.
Okay.
The doctor is treating a nerve that is very sick. When it involves root canal treatment, the dentist has to first make the diagnosis that the nerve is irreparably damaged. Damaged frequently by the tooth decay or by the accident. So when that happens, the dentist already knows that the nerve is dying and is not going to recover, or that it died a long time ago and it is at a stage where there is infection. And so the root canal treatment involves cleaning the channels in which the nerve and blood vessels lie, those which are sick, getting them thoroughly cleaned and then filling them with an inert material so that the tooth can help regain its function.
Well, does doing a root canal treatment weaken the actual tooth that I'm trying to treat?
Yes, it does. But the first thing that weakens the root canal treatment is the actual decay that ate away the tooth, so much so that it reached the nerve for you to require to have the root canal treatment done. By the time root canal treatment is done on a tooth that is suffering from tooth decay, a lot of the damage has been done by the tooth decay that has caused it. When you do root canal treatment, or let us go back to a normal functioning tooth. Well, this is the diagram of a tooth, but it has a hole. But before it has a hole in the tooth, you have dentine. And the dentine is fed by the blood vessels that come into the pulp chamber here. The dentine is actually wet. It's like the bone in your arm. It has fluids in it. And those fluids give it the mechanical properties that allow it to have strength. When you do root canal treatment, you remove all the fluids in here and replace the pulp chamber with an inert material. And so when you do that, the dentine dries up. When it dries up, it's like removing the bone from your arm and placing it on the shelf for a couple of weeks. The fluid that would be in there dries up. And when it dries up, the bone then has different mechanical properties. And so the dentine would also have different mechanical properties and thus becomes weaker. So the tooth after root canal treatment is not as strong as it was when it was before root canal treatment.
Dr. Ntwatwa, when and why do I need to do the root canal treatment?
Well, there is more than one scenario. The commonest scenario is when your tooth has suffered from tooth decay and the decay has reached the nerve of the tooth. Let me show you once again. Here is your tooth with a cavity. It is extending down through the enamel and through the dentine. And if it reaches the pulp chamber here and the bacteria enter, the bacteria give off toxins, okay? And those toxins cause the pulp chamber to become inflamed and very painful. And when that happens, the nerve gets irreparably damaged because of the bacteria that have entered. the pulp chamber here. Eventually, when that happens, all the tissues in the pulp chamber get diseased and you get pus inside here, which travels down the canal, out of the tooth and into the bone. So, as long as the bacteria have entered the root canal, to save the tooth, ideally you need to have root canal treatment done. So that is one scenario caused by tooth decay. Another scenario is when you have an accident. And this comes especially with the front teeth. As I can remind you once again, maybe with a different diagram, that each tooth has a blood vessel that feeds it through the end of the tooth, and it enters the end of the root and into the root canal. If you traumatize this tooth hard enough, it moves within its socket and it can crush the nerves and blood vessels here, causing the blood from the broken blood vessels to pour into the pulp chamber. But because the blood vessels are broken, you will no longer get a blood supply going inside the tooth. And so the nerve of the tooth will die because of lack of nutrients. So that is another scenario where you need root canal treatment. Otherwise, when the nerves die, the tooth becomes sensitive, and eventually the area here becomes pussy and comes out of the little hole at the end of the tooth, back inside the bone, sometimes to cause an abscess. So root canal treatment will help alleviate that problem. So those are two scenarios where you can have root canal treatment done. One, because of tooth decay that has caused enough damage to reach the nerve of the tooth and infect it. And in another scenario where you have had an accident.
Well, is root canal better than tooth extraction?
Well, my primary role as the dentist is to help you maintain your dental formula. And so if I find that you can keep your tooth and I give it root canal treatment and you keep your tooth, I think it would be better than if you knocked your tooth. It would be necessary for me to remove it. I think it would be better for me as a dentist to try to help you keep your formula, and sometimes a minor accident, which can actually be easily treated through simple means like root canal treatment, can help you keep your tooth rather than having to lose your tooth.
Yeah. Well, what should I expect after doing the root canal treatment?
Well, for a tooth at the back, usually the root canal treatment is done after a lot of damage has been done by tooth decay. So there will be a substantial amount of tooth substance missing, which will mean that the tooth is no longer very strong. The structure of the tooth which is left is small. Also, if you remember back, one of the effects of the root canal treatment was to weaken the tooth. Okay? And the tooth becomes brittle, and it will no longer have the mechanical properties adequate for normal function, which means that you can try and use the tooth in normal function and it breaks or fractures. So what we try to do is to use a full coverage restoration, and that is by means of a crown, to protect the tooth by having something strong all around the tooth, such that you can use the tooth normally.
So if I think of coming to Dr. Ntwatwa for a root canal treatment, how many sessions should I expect?
How many sessions should you expect? Well, there are different schools of thought here. But let me first complete the previous question on what are the effects. For a tooth at the front, one thing you are likely to get is tooth discoloration. Frequently, when you do root canal treatment, sometimes because the nerve has been damaged and you end up getting pus and blood inside the pulp chamber, it tends to line the inside of the dentine. And when it does so, the breakdown products of the blood, some of those products will color, because they are red, they will color the inside of the tooth, and the tooth will end up slowly becoming darker and darker. So that is another effect. One, the tooth will weaken, and secondly, the tooth will discolor. This is of course seen more readily on the front teeth, but the back teeth as well, they will also discolor in the same way. It's just that they're not readily seen, and you also may not see it because a crown has been placed there. But the tooth also discolors at the back. So, your question again?
How many sessions should I expect in case I choose to come to Dr. Ntwatwa for root canal treatment?
Well, maybe one session. There are different schools of thought, and maybe in a very busy practice where you may only be given 15 minutes to treat somebody, because some practices, they design their appointment systems that you have 15 minutes to do something. It would be very difficult to do root canal treatment from beginning to end in only 15 minutes.
Okay.
So you may have to break it up for that reason. However, in most cases, there is no reason why you can't do a root canal treatment from beginning to end. There are sometimes a reason. Failure to dry a canal properly. Sometimes when you do root canal treatment, depending on its stage. Take a scenario where the person has suffered from tooth decay, the nerve has been destroyed, it has turned into pus inside here, the pus has flown out of the end of the tooth and into the bone, and has caused what we call an abscess. That is pus in an area where the bacteria are multiplying. It's very painful because it is in bone, which cannot swell like the skin on your arm. So there's high pressure. There's a lot of pain when you bite on your tooth. So when you come to do the root canal and you clean the canals and dry them, you may fail to dry the canal adequately, because every time you dry it, the fluid of inflammation seeps back inside the tooth because it's under pressure. So you may continue doing that for a long time, and you never end up drying the tooth because something keeps coming back. And if you close off the canal at that stage, then you would have left in pus and infective material in this area. Yes, you do give antibiotics when the tooth reaches such a stage, but then in the principles of treatment of an abscess, which is incise and drain, you have done the incision, and it is usually best to leave the tooth to drain, or the abscess to drain inside the tooth, and complete it on a subsequent occasion. So on those rare instances where you cannot dry the canal, it would be best to leave it on open drainage, or you place a disinfectant material in it and you give it more time, and also put the patient on antibiotics, and then complete the root canal on a subsequent occasion. But in most cases, the root canal treatment can be done once.
I would like you to give advice to different patients out there who are like me with the same kind of thinking, and we're really afraid of root canal until today. I would like you to advise those people.
Well, root canal treatment is treatment that is there to help save your tooth. And frequently, if you have a choice of removing the tooth and keeping it, then it's usually better to keep the tooth if the tooth is functioning, if the tooth is useful to you, if the tooth is helping you to smile, then it would be better to invest in the tooth, because when a gap occurs afterwards, sometimes you may have to invest even more in replacing the gap, or you have to invest more because you have lost the tooth, because of the after effects of losing the tooth. So if the dentist advises you to keep the tooth, then go for root canal treatment.
Is it done the same way on children, adults, and older people?
The answer is no. It's not done the same way. Every patient, first of all, is different, and many situations are different. So no, there are many things to consider. Maybe if you can start with the children. No, root canal treatment isn't done the same way. The structure of the child's tooth, especially the molar, is not the same as the adult tooth. First of all, the canals, many are not one, frequently. They branch with each other. So it's very difficult to single out a single canal in the child's molar. Secondly, the child's molar root does not remain the same throughout the life of the tooth. If you remember, the child's molar develops between the ages of 2 and 3, and then by 11, 12, sometimes 10, they lose the tooth.
Yeah.
So when the tooth has just come up into the mouth, the root is short, and it elongates as the child grows, becomes maximum. Then after that, it starts to shorten again. As the time of exfoliating the tooth, when the tooth starts to shake to give way to the adult tooth comes, the root gets shorter and shorter and shorter. So you find that the length of the root doesn't have a standard length, but it changes with the age of the child. So you can't really treat someone the same way when it comes to that. So when we do the equivalent of root canal treatment for children, we basically try to treat the pulp chamber with different types of materials, and control the infection with different types of materials that remain within the pulp, and tend to leave and tend to treat the roots by mummifying them. So for children it is slightly different, or very different. When it comes to the very old people, there are other things to consider. Their general health. Are they able to open their mouths for an hour and a half? Now for you, I think you'll be fit enough to withstand treatment for an hour and a half or 2 hours on your molar. without much undue discomfort after that. Someone in their 90s may not be able to do that, and you may be forced to break up their treatment simply because they cannot open their mouths for a long time. You may end up treating the tooth, but the person may end up spraining their jaw, and they become unable to open their mouths for 2 weeks after that. So you have to consider everybody in their situation. You have to observe the person you're going to treat as they walk into the room, and eventually decide that, are you going to treat them the same way as you treat everyone else? If the person you have sent to the x-ray room to have an x-ray taken, and they have to sit down and rest for 5 minutes before they come back because of their age and health, then you really have to modify how you treat that person to end up with the same treatment, but you have to treat them such that they also remain healthy. The canals in a very old person are not like an adolescent. When the tooth is newly formed, if I can have this as an example, if I could just shift this over here. This person from this x-ray is roughly 15, because their wisdom tooth is roughly at this stage, 14, 15. And when you look at these two teeth here, well, actually all of them, the canals are easily seen, very easily seen. And so the treatment becomes easy because the size of the canal is obviously fairly wide, and it would take less time. If I give an example of someone who is a little older, so here we have someone who is a little older than you.
Like how old?
Someone in their 50s.
Okay.
When you look at this tooth here, you can hardly see the canal system. On this one you can see, but it's much, much thinner than someone who was young. When you look over here, you can also hardly see the canal system.
Okay.
So when someone is a little older, their canals become very narrow, and sometimes almost not visible on x-ray. So it would take you a lot longer to perform the same job, simply because the canal is very tight and very small, and to clean it thoroughly and shape it, you need more time. So if you need more time in someone who's very old, then they're not likely, also the same person is also less likely to be able to stand the length of the operation. You may have to break it up for those reasons as well. So everybody is different, and you have to look at their medical history, you have to look at their general well-being, you have to look at what they've been through before. The x-rays you take will help to diagnose properly the situation and to help you to see any difficulties and challenges that are likely to come up during the treatments you want to perform. So you have to plan accordingly and say, well, because of this reason and this reason, we may not be able to do it all in one session, and do it in portions. So yes, the treatment would be good if it could be done in one visit, but it's never the same for everybody.
Okay. Well, we would like you to give out the complete last remarks as we come to the end of the show. And also, don't forget to give out your contacts just in case somebody would like to ask more questions.
Root canal treatment is done by dentists to help you save your teeth. One of the primary functions of the dentist is to help you save your teeth. And if root canal is the way, then go for it and keep smiling.
It was really nice having you on the show, Dr. Toto. Well, we've been with Dr. Toto today, and I guess you could also hear what he's been saying. And remember to visit your dentist whenever you can. Living a safe life is your right and responsibility. I remain Ishime Kathy. Stay blessed.